I'm going to go over, it actually dovetails perfectly into what Dr. Birkenholz mentioned in terms of active management. And so I'm going to do a case report. My patient, this patient delivered this past summer. She was 36 years old. She was a G2 P1 001 at 41 and 0, and she presented in labor. So she then had a vaginal delivery, and she had a very normal blood loss of 330 milliliters. We do QBL for every single delivery. And then after, let's see, I think it was after about an hour, as this slide comes through, an hour and 35 minutes, the nurse called out and said that she noticed that the uterus was a little bit boggy. So we came to evaluate. I was working with a midwife at the time, as well as an intern, and the midwife performed the uterine sweep. And there was an additional 329 milliliters of clot that was removed, which put us over 600 milliliters of blood loss. At that point, we gave Cytotec as our first uterotonic. This patient had already received her normal postpartum Pitocin. And we did a bedside ultrasound. As Dr. Birkenholz said, we do multiple bedside ultrasounds. It's a great tool for learning. And so we identified additional blood clots inside the uterus. And so at this point, we decided to place the JADA system. We had confirmed that this patient had atony. We did an additional uterine sweep, and the JADA was inserted. So the QBL at the time of the placement of the JADA was 659. After the JADA was placed, we left it on active vacuum for an hour. And my nurses are very specific and always tell me that the tubing, if it's full, is 116 milliliters. And so this patient only had 100 milliliters of QBL that was just in the tubing. At that point, we did our observation period. We reassessed the patient. They didn't have any additional bleeding after the vacuum was discontinued and the cervical seal had been deflated. That observation period was about 45 minutes. The JADA was removed. The patient didn't require any additional uterotonics at that time. It's our practice to, if we do multiple uterine sweeps, to give a dose of prophylactic antibiotics. So we give a dose of cefazolin or Ancef. So this, I feel like, really shows the team approach of managing abnormal bleeding with the goal of keeping the blood loss less than 1,000. And for this patient, the patient, didn't meet criteria for postpartum hemorrhage. And I think I meant to mention earlier, this patient didn't have an epidural, and she tolerated it quite well.